Hi, welcome. I'm Amanda Yarnell, and I run the Center for Health Communication here at Harvard Chan. I'm also a lecturer in the Department of Social and Behavioral Sciences. And the Center for Health Communication is presenting today's event with a studio here at the Harvard Chan School. I'm delighted to be here with Katelyn Jetelina, the epidemiologist behind the popular public health newsletter, Your Local Epidemiologist. Hopefully some of you, like myself, are already subscribers. Our conversation today is part of the Dr. Lawrence H. and Roberta Cohn Forum series. The studio thanks the Cohn family and welcomes them here today. So let's begin. All right, Katelyn, let's start with the beginning. You started the newsletter early in the COVID-19 pandemic, and it was written for a relatively small audience of students, faculty, and staff. And now it has more than 250,000 followers, maybe even more, a team of writers, and a mission that's far broader and deeper than COVID updates and just alone. So what inspired you to get started, and how has that evolved over the years?
What inspired me to get started? Well, it was never planned, I'll say that. March of 2020 hit, it was all hands-on-deck response as us epidemiologists. We're disease detectives. My dean actually came to me and asked for me to update faculty, staff, and students every day about what I was seeing, what was going on, walking them through what I was doing with my family. I was pregnant. I had a 9-month-old at the time. Everyone had all this questions and confusion, and so I just started updating, and I signed these emails. It was probably to only about 30 people in the beginning. Love, Your Local Epidemiologist, because that's who I was to them. And then a few days later, one of my students came to me and she's like, Dr. Jetelina, can you just start putting this on social media so I don't have to keep copying and pasting these emails for my family and friends? And I distinctly remember telling my husband, I'm going to only have to do this for 6 weeks max, because surely by then someone will pick up the baton and actually explain to the public what is going on in real time in understandable terms and what they can do about it. And that never happened. So here we are, 4.5 years later, reached over 400 million people in 132 countries. And I still think every day it's just going to just stop. People are just going to stop reading it, and that hasn't happened. And so I think it is a testament to how hard I worked, but also that there was this huge gap out there that needed to be filled, and I'm honored to help fill it.
Yeah. So maybe what surprised you the most, it feels like? Maybe the gap surprised you most, that it wasn't getting filled by somebody else.
I was surprised about that.
Yeah.
I was surprised that this was never really identified before. Public health is called the invisible shield. It works when you don't know it, right? How many times have you really thought about wearing a seatbelt that saved your life, right? It's not something we think about every day. But I think that's also our downfall, is being invisible and not talking about what we're doing and not talking about how many deaths we're preventing, or that you can go to Disneyland today because there was not a measles outbreak. And so it's a big culture shift in public health to actually start talking about it. And I think one of the reasons and one of the lessons public health learned during COVID-19 pandemic was that this wasn't there. Yeah. We need to learn how to communicate. We're not taught how to communicate in public health, and that needs to change.
Yeah. All right, we're going to talk about that a little bit more later, but you've expanded your coverage well beyond COVID to mental health and reproductive health and lots more. So how are you deciding what content to write about, what gaps you think your audience has?
Well, some of it's selfish. It's what I want to talk about and write about. Before COVID, I was actually a violence epidemiologist, and so very interested in how violence spreads like a contagion. And so I can certainly bring that in. But it's also what's on people's minds, right? Everything, all types of different public health topics touch us every single day, right? Whether it's stress, whether it is reproductive health, whether it is gun violence in the school and mass media. And so it's something that I kind of try to follow what the wave is of information. I don't try to break news. I cannot compete with New York Times. But what I do see myself as is I can provide really important context and narrative around that data around the public health problem and ways people are thinking about it in this space. So I kind of just follow the waves of information and see where it's taken me. And it's not really planned. It's kind of what happens that week, and we'll go from there. So it's been a wild ride.
So I'd love to talk a little bit about lessons learned, and I feel like maybe one of them is, what have you learned from doing this that you'd like to share with other people?
Yeah, I think these are going to sound silly to a communication school, but one of the biggest lessons I learned was to listen, not hear, but to truly listen. I was an epidemiologist in Texas in the South, and I had to listen if I wanted to get anything across in the field because I was helping with the responses at the time. And that has not only helped my field work as a scientist, but also has helped my newsletter as a communicator. 90% of the content about what I write is not what I find interesting. In fact, I was telling, whenever I do write something that I find fascinating as an epidemiologist, right, like how a virus is mutating or what we're looking out for, it totally flops. No one cares because it's not relevant to their day today. They want to feel equipped to make decisions, evidence-based decisions today. And so, unfortunately, sometimes that means it's a little boring for me to write, but really important. And so, throughout the years, I've tried to figure out how to create systems to listen, whether that's social listening, whether that's literally comments and messages I get in. I get so many emails, thousands a day. I actually had to create a system to start looking at themes of comments so to understand where the information voids were. So listening was a big thing. The other lesson I learned was to be human, to humanize my writing. Some of the most viral things I ever write was about what I do as a parent, as a mom. And I think that this is where I tell CDC all the time, this is where they failed during the pandemic, is because no one trusts a brick wall, right? They trust people that they can see, that they can feel, even if that means all of their flaws too. I got stuff wrong all the time. I had grammar mistakes. I even got some policies wrong. But people trust that. They trust humans, and I think that we can't hide behind institutions or even our writing. We need to let that human come out because that's what people trust. I can go on of how much I learned, but because this isn't what we're taught, right? Yeah. I never had 1 hour of one course on how to communicate. And I think that's a huge problem in public health and why we need to partner with schools of communication. Because there are best practices out there that other people have already learned, and we need to take and go with it.
Yeah. So listening and finding that point of connectivity being just such. Yes.
Big parts of it.
Yeah. So think about public health workers, right? You write a newsletter, but what can public health workers or people in public health do in this area of listening that would improve their work?
I think that one thing I've learned is that this top-down information flow from the ivory tower does not reach the households that they used to. We are in a different information ecosystem, and that means that we really have to communicate from the bottom up. And some of that means humility. That sometimes means if you're a state epidemiologist, for example, if you're Dr. Katelyn Jetelina at the CDC, sometimes you're not the best messenger for that. You need to go find the pastors, and you need to go partner with the education boards, and you need to go equip them with the message because people trust them in the community. And so I really think that equipping trusted messengers has to be a key role in public health. Sometimes we're that trusted messenger, sometimes not. And I think we need to recognize when we're not and maybe back away a little too.
Yeah. Look what those trusted messengers need to be successful, right?
Yeah. A fantastic example right now is H5N1. H5N1 is the bird flu, and it is spreading. The most high risk right now are people that trust in government the least. rural workers, undocumented workers, people that are drinking raw milk. And there's legitimate reasons they don't trust the government either. But what that means then is we can't then go into farms and then automatically assume they're going to listen to us and put on goggles. We need to find who they trust, their physicians, their farm operators, et cetera, to help equip them with whatever public health message they need. The other thing is, I know we have like very limited time, I'm going to keep talking now, is the need to open up a two-way street. Yeah. One thing I learned in public health, especially during the pandemic, and right now, especially during H5N1 response, is that what we find important isn't necessarily what's important to those people. H5 right now, people don't care that they get a little red eye after being exposed to some milk. What do they care about? Well, the only reason you're going to know is when you ask. And farm workers right now really care about their coworkers killing themselves. They really care about suicide right now. And so what are we doing? You have to start integrating mental health, suicide prevention in the H5 response. And so you create this two-way street where I can help you, but you can also help me at the same time. It's really one of the only ways you're going to get public health to move is to meet people where they're at. Yeah,
couldn't agree more. All right, one thing that we talk about a lot is how to communicate about uncertainty, right? I think we both probably have some thoughts on on how that's played out in the past couple of years. But I'm wondering what you've learned in writing this newsletter about expressing nuances like uncertainty in a way that still motivates action and keeps people with you.
Another two big lessons I learned is one. If you communicate an absolute certainty, you're going to be wrong and you're going to look like an idiot and you're going to lose trust. The framework that I always used after I learned that hard lesson numerous times was, what do you know, what do you not know, and how are you finding answers? If you stick to that and are transparent and honest in answering those, you'll actually never really be wrong. And in fact, when you're able to do that, people can then understand the scientific discovery ride and pivot when things change because you're helping them anticipate that things may change. That's how science works. The second thing that I have found, and I think this actually goes against like COM 101 PR advice, is that to never underestimate the public or your audience. People want to know why mRNA doesn't change your DNA, right? They want to know what myocarditis is. And you know what? They deserve to know. But they also need to be communicated in words that they understand and in a way that they deserve with empathy. And one huge lesson I learned was that people want nuance. We're in this information ecosystem where you can easily Google what is myocarditis, right? But what they need experts on is more of that context, more of what to do about it, and more in a timely manner from someone they can trust. And so, don't underestimate the public and communicate uncertainty. For the love of God, communicate uncertainty will help a lot in getting messages out there, especially during an emergency. Yeah.
And in the aftermath as well, right? Because you set yourself up, right? All right, so let's talk about talking to people across the political spectrum, right? We're a week out or so from the election here in the United States. So this is incredibly important, I think. How can we establish common ground?
Yeah, so one interesting thing about my newsletter is I started in Texas. So I actually have a very diverse audience. Every year I do a survey because I don't know who I'm talking to. So I ask, who am I talking to? And, one of the most proud things I am is it's across the political spectrum, both in social and fiscal political views. And one of the reasons for that, I think, is it started in Texas. I'm one of them, right? I'm relatable. But also in my approach thereafter. I think one thing people don't realize, at least in the public health world, is that words matter. what you say matters. How you communicate correct information matters, especially to people that are hesitant or believe in conspiracy theories, because all you do when you use unempathetic words is you alienate them, because they're part of the tribes and they're going to double down because that is their identity and the tribes they're a part of. And so literally words, so in my newsletter, you will not find the word misinformation in there. That is a trigger word for Republicans. So I use the word falsehood or rumor, because if my goal is not to go viral among my tribe, I know how to go viral among public health, right? I can stoke those emotions. But if my objective is to reach people that aren't going to be necessarily finding an epidemiologist, I want them to approach my writing in a way that won't turn them off automatically. And so, yeah, words like misinformation matters. And the framing matters too. And people know my bias. You know, I don't think Republicans are surprised of who, for example, they probably assume I vote for. But I do think that in public health, people very much deserve to know the data in the most unbiased possible way. So then they can add their values and their decisions to that data. And so that's how at least I approach COVID. That's how I approach even reproductive health or gun violence, is that there is an underlying foundation of data that we all need to agree upon. And then, yes, you can add your values and your perspectives on top of that. But if we can't even agree on a foundation of data, then it's kind of hopeless. And so I think that there are certainly places and spaces that people want that and need that. And that's at least how I try, to be determined. But, you know, I think people appreciate that. And being very forthcoming when I'm adding my value versus when I'm actually interpreting scientific evidence.
Yeah, fascinating. All right, I want to pivot a little bit and talk a little bit about social media. We know that many people are getting at least some of their public health information via social media today. I'm wondering where you see it fitting into the ecosystem of health news and information, and how are social media communication strategies different from those used in these other more traditional channels?
Yeah, I mean, it's a new information landscape, right? Only 30% of Americans trust in the news overall. We have social media. It's a huge part of how people get their healthcare related information. In fact, 1 in 2 Americans get their healthcare related information on social media. And so we need to, in public health, we need to get up with the times and be there, right? That's where the conversations are happening. If we're not there, there's those questions and confusion are going to be filled with misinformation, and that's what we're seeing because people can't find answers to their questions. And so that approach is very different on social media, right? When I write a newsletter, I'm writing to a completely different audience that's on my Facebook versus my Instagram versus on my Twitter versus on my LinkedIn, right? They're all very different audiences. And with that means the words we use are different, the approach we use is different, how we create the content and the topics are different. The problem is capacity, right? And if I was a one-woman show, now I have a staff of 15, but before it was, if you can only do a few, where do you pick? And so absolutely social media is a part of it. And we need to figure out how to find those influencers and equip them with public health information, become one of those influencers, and then also incentivize scientists to be on social media. Where do you put it on your CV that your TikTok went viral, right? But that actually has a big impact that we're not measuring. Maybe
bigger than, your last paper, potentially.
Yeah. So my peer-reviewed papers, right, I don't know, 100 or something. They would get average, 5 reads or something. Yeah, my Substack, it'll reach easily 1 million people, right? So that's where I'm saying the institutional culture needs to change around that too. And unfortunately, culture takes a long time to change. we're just running out of time. People are taking the narrative and running with it, and then we're mad when there's mis and disinformation out there, but we can't be really because we're not in the arena at the same time.
Yeah. So I want to get back to that countering misinformation and disinformation, maybe particularly on social. You talked a little bit about how you think about it in your newsletter. How do you think about it on social?
I think the hardest part about combating mis and disinformation is knowing what to combat when. Yeah. There's so much out there. So my rule of thumb is if I see it 3 different places going viral, I'm like, okay, fine, this is time to start talking about deaths after a vaccine, right? So I think that's hard. The other thing is that it kind of comes back to my last point, is that I think of mis and disinformation as the tip of the iceberg. That about 80% of the reasons why people are consuming mis and disinformation is actually below the surface. Is the confusion, it's the questions, it is the anxiety. They can't find answers to those questions. And so I think in public health, if we have limited capacity, we need to focus on what's beneath the surface if we want to move this iceberg away. Yes, focusing on mis and disinformation is sexy. Everyone's talking about it. There's a nemesis, right? There's someone to blame. But really, we need the work underneath the surface to be done first. And it's not as sexy. It's not as fun, but it's where that foundation lives that I really think we need to focus on. So my newsletter, you'll see me combat mis and disinformation, especially if it's coming from a big news, right? Politician. But it's a game of whack-a-mole. And actually, a lot of people don't realize we don't know what works against mis and disinformation. And so I really tell departments of public health, I tell the CDC, I tell everyone that you really need to more focus on getting our house in order first before kind of focusing on the top.
And listening to what is maybe driving some of those questions.
I mean, those questions are being driven because of information voids, right?
Yeah.
People have legitimate questions out there. Would vitamin D help my cold? Because I need to get back to work, or my kids are driving me insane at home, right? And I think those are legitimate questions and they can't find answers to them. So finding those information voids, trying to fill them from a place of empathy, and doing it in a timely manner is part of the secret sauce. It's hard though. It's kind of scary out there.
Yeah, you mentioned earlier that you had maybe gotten 1 hour of education on the things that you're doing right now. So I want to go back to communication education and talk a little bit about what can we do to integrate communications training into the curriculum so that the public health workforce graduates are equipped with effective communication tools. More people go out in the world being able to do, close these gaps.
Yeah, I mean, I think low-hanging fruit is integrate comms into public health. Unfortunately, we have these things called CEIF requirements at schools of public health, and those are really hard to change. But I think that even you integrate soft skills into classes, right? So when I was teaching applied data analysis at University of Texas, instead of having my students write a report, I asked them to write a policy brief instead, or write an op-ed about this topic, or write a social media post, right? So like the end product can be very different. We just need to value it. And we also need to teach how to do that. And it's hard to do it if you don't know how to do it yourself. So I think that's where schools of communication can really come in. And again, incentivizing. There's no incentive for faculty to be doing this stuff. And I don't blame them. That's not how you get tenure. When I was going up to tenure, where do I put YLE on my CV? It was one bullet under service, right? And so I think that carrot approach needs to be built out more. And how you do that is above my pay grade, but I think an important part of the equation.
Yeah. What advice would you have for, say, a faculty member who wants to do more of that kind of work, but is in this environment?
That's a good question. I mean, I think the take a jump, take a leap, and try. I will say it's challenging doing it within an institution, especially when I was at a state institution, because your state funding comes from the state, which then has influence on what you can say or not say in a very real manner. But I think you start chipping away at it, whether it's at Twitter or whether it's an op-ed that you submit to Stat News or you submit to me. I will publish yours, right? It's trying. And I think when you can start taking that and you start getting quick wins and you start seeing the impact of your research. I mean, Joe is here. He moved mountains by talking about his research on social media. You'll drink the Kool-Aid and you'll start feeling that impact. And once you can do that, then good luck to the institution, because you're like off and running. But I think that we need to show the value in it, and that is a culture change too. Yeah, very interesting.
All right, so what would you leave our audience with? What kind of final thoughts do you have?
I think, what are my final thoughts? I think that one of the best ways you can be a communicator is listen, lead with empathy and humility, and realize that if your objective is to change minds, is to lead people to evidence-based decisions, you have to meet them where they're at. And that can be many different things depending on your audience. But I think us in public health really need to figure out a new way to approach information and how our research reaches people. So think very innovatively and take a next step, take a dive, because it's an all hands on deck response. This is not something that I can just solve or Joe can just solve or Amanda can just solve. It's going to take an entire team effort and an entire field shift. And it starts with all of us. So I invite anyone to come help us, because we need it.
And what would, if you were starting all over again, rewind, what would you do differently?
What would I do differently? I would be more careful about my safety, honestly, my personal safety.
Super important.
It's different when you become a public-facing person. You start receiving packages at your work, and people come to your house and send threats to your kids. And so I think that if you're getting in this space, one of my biggest pieces of advice is to protect yourself while you're doing that, both your mental health and your safety. And you can do that through institutions. Institutions help a lot with that. My university helped a ton. You can do that by creating your own little neighborhood of support systems. And you can do it also from taking a step back too when you need it. Because like I said, it's ugly out there. And we need communicators that can last long. And by doing that, you protect your own mental health. So I guess that's the one thing I would change now that I'm like bright-eyed and realize what the world is. Not everyone likes epidemiologists, I guess. So I think it's just one of those hard lessons.
You're changing minds one at a time. Very good. All right. Well, our live stream is coming to an end. Katelyn, thank you so much for being here. I really appreciate it, and we really appreciate it. It's been wonderful. And I want to thank you all for being here today, as well as for this thoughtful conversation. If you missed any of the program, you can watch the recording here on Harvard Chan's YouTube channel. Our in-person audience is invited to stay after the conversation with Katelyn, and I hope you have a great afternoon. Thank you.